Hello, Assalamu alaikum. Welcome to my YouTube channel, Dr. Study Tutor. Today, I will discuss about a very important topic in second professional exam of microbiology, that is neisseria meningitidis. We all know that it is a gram-negative cocci. For better learning, please see my previous video. Its common name is meningococci. Then the first viva question in this topic is, what is the morphology of neisseria meningitidis? তাহলে উত্তর হবে, it is gram-negative oval cocci. So why it is gram-negative? We all know that it does not retain the crystal violet. So it gives red color in the gram staining method. So it is gram-negative cocci and its shape is oval. Then another point is occur typically in pair, diplococ, with adjacent side flattened. Neisseria meningitidis এর মরফোলজিতে আমাদের ডিপ্লোককাই কথাটা বলতেই হবে। The Streptococcus pneumoniae, it is also a diplococci bacteria, but it is a gram-positive cocci. And the neisseria meningitidis is gram-negative cocci. Another point is, has a prominent polysaccharide capsule. Another point is, contain endotoxin composed of lipopolysaccharide in their outer membrane. It is also well known as virulent factor. And the next point is non-motile pileated. We can also remember that the shape of neisseria meningitidis resembles as bean or kidney shape, and it is red in color. This is the picture of neisseria meningitidis. We can see that here is the diplococci bacteria. They arranged in pair. They are oval shape and the adjacent part is flattened and they are red color, because we know that gram-negative bacteria do not retain crystal violet stain in gram staining method, so it gives red color. By this picture, we can identify neisseria meningitidis easily. Serotype. There are present 13 serotypes in neisseria meningitidis. The most important serotype are A, B, C, Y, and W135. Another important viva question is virulence factor of neisseria meningitidis, or pathogenicity of the neisseria meningitidis, or how neisseria meningitidis causes disease. So the virulence factors are a polysaccharide capsule, which is the most important virulence factor. The functions of polysaccharide capsule is antiphagocytic and it is commonly used in the formation of vaccine. Then second one is endotoxin, causes fever and shock. Third one, another one is an immunoglobulin I or IgA protease, helps the bacteria attach to the membrane of the upper respiratory tract by cleaving secretory IgA. Another virulence factor is factor H binding protein. Bind factor H or the presence of factor H, it reduces opsonizing activity of the C3b and reduce the amount of MHC. Here we can also ask by a question that what is opsonization? Opsonization is the process that enhances the phagocytosis reaction by the help of a protein called opsonin. Another important question is clinical finding of neisseria meningitidis. The answer is meningitis and meningococcemia. Meningitis. Neisseria meningitidis causes suppurative lesion in meninges involving a spinal cord, brain, cortex. Then another important question is classical signs. The classical sign is confusion, fever, headache, neck rigidity. And there is an increased level of PMNS, means polymorphonuclear leukocytes. Meningococcemia. Symptoms of meningococcemia: fever with chill, malaise, and purpuric rash. And this disease is characterized by the high fever, shock, weather spread purpura, DIC, disseminated intravascular coagulation, thrombocytopenia, and adrenal insufficiency. Another important question for written and viva is laboratory diagnosis of neisseria meningitidis. First of all, specimen. The specimen are CSF, blood, nasopharyngeal swab in detection of carrier. Then CSF examination, physical examination, biochemical examination, and cytological test. In physical examination, appearance turbid, color purulent, pressure increase. In biochemical examination, sugar markedly decrease, protein increase, and chloride decrease. So their sugar and chloride is decreased, but protein is increased. In cytological test, WBC and neutrophil both are increased. And then microscopic examination, gram staining. Here we can see that gram-negative cocci arranged in pair. They are called diplococci. Then another third point is culture. Here the media is chocolate agar media, which is a enriched media incubated at 37 degrees centigrade in 5% carbon dioxide. Another media is Thayer-Martin media. This media contain antibiotic which are facilitate the isolation of neisseria meningitidis from normal flora. দেন এবং ভাইবাতে আরেকটা কোশ্চেন অনেক বেশি জিজ্ঞাসা করা হয়, তা হলো কেন আমরা ব্লাড আগার মিডিয়া ইউজ না করে চকলেট আগার মিডিয়া ইউজ করব। উত্তর হবে টক্সিক ট্রেস মেটাল ফ্যাটি অ্যাসিড ফাউন্ড ইন দ্য ব্লাড আগার মিডিয়া হুইচ প্রিভেন্ট দ্য গ্রোথ অফ দ্য ব্যাকটেরিয়া। Therefore, we can choose enriched media, that is chocolate agar media. Heated blood at 80 degrees centigrade used to inactivate the inhibitors. Biochemical test. Here we can find that oxidase positive and ferments both glucose and maltose. And then polymerase chain reaction, detection of meningococcal DNA. In oxidase test, the organism produce cytochrome C oxidase enzyme. This cytochrome C oxidase enzyme oxidizes the reagent tetramethyl P phenylenediamine to endophenols, purple color in product. When the enzyme is not produced, the reagent remain colorless. Then another important topic is treatment, which is important for viva and written. The treatment can be done by the penicillin G drug of choice and third generation cephalosporin. And then prevention. Prevention is occur by the chemoprophylaxis, rifampicin, ciprofloxacin, immunization against group A, C, Y and W135. Very important viva question is etiology of meningitis according to age. Or the external asks you what are the bacteria causes meningitis in school going children. The answer is in the age newborn less than 1 month, the bacteria are E. coli, group B Streptococcus, Listeria monocytogenes. In infant and child age 1 month to 12 years, this is mainly school going children. The bacteria are Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenza type B. Then adolescent, 12 year to 18 year and young adult, Neisseria meningitidis and Streptococcus pneumoniae. In older adult, Streptococcus pneumoniae, Neisseria meningitidis and Haemophilus influenza and Listeria. So this is all about Neisseria meningitidis for both written and viva. Hope you like it. If you like it, then please subscribe to my channel. Give a like and write a comment that what you want next. Thank you. Assalamu alaikum.